So one of the things I see a lot with people with patellofemoral pain, so pain that's in, around or behind the kneecap, is that the soft tissue and the fascia, the connective tissue that are very close to the kneecap, particularly on top and around the sides, can often get very tight and feel sticky. And because patellofemoral problems are often caused by compression, so the kneecap is being pulled too far back in the groove and pressing against the femur, and therefore the cartilage gets irritated. I think sometimes the excessive tension in the tissue in this area can contribute to some of the discomfort and pain. And certainly this is a technique that I've used successfully with some patients to relieve some of the patellofemoral pain. So I'm just going to sit up here now. It's important that your leg, when you do this, is stretched out, because if your knee is bent, your kneecap can't move. So we want your kneecaps, your knees straight so that your patella can move, and we want everything relaxed. So if you are sat up if you have to reach too hard to this and your hamstring is super tight, again, you won't be able to wiggle your kneecap. And you can see my kneecap doesn't wiggle when I'm bent forward, but when I'm back, I can relax and it will wiggle quite nicely side to side. So once you've got in a position where your leg is nice and relaxed, you will feel, hopefully, that you can take a pinch of skin and fatty tissue and fascia off the kneecap. And then I use a rolling technique. So you can see I'm just grasping extra tissue with my fingers and my thumb is moving down. And I can do that with both hands. So I'm just trundling my way down, and the same thing, going down the inside, down the outside, and then going across as well. And I find that I get a lot of tension, or I feel a lot of tension in a lot of people around the edges. So I'm just sort of pulling the tissue away from the kneecap in both directions and really just trying to sort of soften everything up. And after a while, when you first start, it will often feel quite tight and sort of burning discomfort, as though we were back in the playground, somebody's twisting your wrist, if you remember that. So you can often feel that, and I think that's sort of fascial tension to start with. And then as you roll around, I can feel this tissue getting looser, and I can feel that I'm able to take a bigger pinch and it's getting less uncomfortable. And then what I often find is that if your kneecap was tight to start with, you'll often find that it gets more wiggly. And the other thing you can do from here is to start trying to lift your kneecap off. So just grab the sides with fingers and the thumb, and just try and pulling it up and off the leg. And again, we're just trying to create some space really, and some stretch between the kneecap and the femur, the thigh bone. And the more you do that, again, it seems to help to relieve some of the pressure. And in some cases, it can make your hamstrings feel looser and more relaxed as well, which again reduces the pressure on the patella. So there you go. There's a couple of techniques, manual therapy techniques to help relieve patellofemoral pain. This does not mean that you can get away with not strengthening your quads and glutes. You definitely have to do that as well, but this is another technique that can help to desensitise the area and make it easier to do the exercise training. So there you go.